Hello everyone, welcome to Community Medicine Insight. In this session, we will do MCQ related with the topic Transplantation of Human Organs and Tissues Act. The Act was amended in 2011 to include organs, blood, organs and tissues or stem cells only. Here the correct answer is option C, organs and tissue. Initially in 1994, this act was known as Transplantation of Human Organs Act, and it mainly dealt with the organ transplantations of organs like kidney or liver and heart. Then the act was amended in 2011 and expanded to include tissues also, which includes cornea, skin, bone, heart valves and tendons. Minimum age for a living donor is 16, 18, 21 or there is no age restriction. Answer is option B, that is 18 years. There is no age restrictions in the case of deceased donor. If we talk about age of recipient, there is no minimum age limit for recipient and also there is no maximum age limit. There was a limit of 65 years in the maximum age, but it was removed in the year 2023. Near relative does not include spouse, grandmother, cousin or son. Here the correct answer is option C, cousin. So near relative includes spouse, grandmother, grandfather, son or daughter, father or mother, include brother, sister, grandparents and grandchildren. So a cousin is not considered a legally defined near relative under the Act. Near relative is a person who is either close genetically or has a legally recognized relationship. The board of medical experts for certifying brain stem death must consist of how many members? So here the correct answer is option C, 4 members are required. The board include the medical administrator of the hospital or the hospital in charge. Second is the treating physician. Third is an independent RMP, that is registered medical practitioner. And fourth is a neurologist or a neurosurgeon. Which one of the following statement is true regarding the certification of brainstem death? Any member of the transplant team can certify death. The neurologist on the board can be part of the transplant team. No member of the board can be a part of transplant team, or only a government doctor can certify brain death. Here the correct answer is option C. Such rules are made to avoid the conflict of interest. Second is to avoid ethical bias. And third is to avoid illegal practices. Required request in the context of Transplantation Act refers to the recipient request for an organ, the ICU doctor's duty to inform the family of brain dead patient about organ donation, the hospital request for funds from the government, or the police request for a post-mortem. The correct answer is option B. We can remember that required request is the mandatory counseling for organ donation. During organ transplantation, the term cold ischemia time refers to, and these are our different options. The correct answer is option C. That is, the cold ischemia time is the time between the cooling of organ after retrieval and transplantation. When an organ is removed from the donor, it is preserved in the cold preservation solution to slow the metabolism and reduce the tissue damage. So this duration is between the organ cooling and retrieval to the implantation into the recipient. There is a longer ischemia time. It can lead to tissue injury. It can also lead to the poor graft function and increased chances of rejection in the recipient. Ischemia time is the time for which an organ can be preserved outside the body. Which of the following organs has the shortest permissible ischemia time during the transplantation? So now we understand what is the ischemia time. Correct answer is heart, that is option C. It has around 4 to 6 hours of ischemia time. Which national body is responsible for the registry and coordination of organ procurement and distribution in India? Here the correct answer is option C. Form is National Organ and Tissue Transplant Organization, and it is at national level. For regional level, we have ROTTO, Regional Organ and Tissue Transplant Organization, and at state level we have SOTTO, that is the State Organ and Tissue Transplant Organization. Who grants registration to transplant hospitals? And here the correct answer is option B, appropriate authority. This appropriate authority is appointed by the government to regulate the transplantation activity, and their function is to register the transplant hospital, conduct inspection, monitor their compliance, and investigate in case of violations. What is the maximum punishment for commercial dealing in human organs under the amended act? Here the correct answer is option C. Apart from fine and imprisonment, there can be cancellation of hospital registration, suspension of medical license, and the criminal prosecution for the illegal organ trade.